Hey everyone, so glad that you decided to join us tonight for another episode of Reawaken Your Brilliance. So in 2 weeks it's Hanukkah, and 2.5 weeks it's Christmas. And so I was thinking, especially during the holiday times, just because you've done something, always done something, or had a tradition, doesn't mean that you always have to. For instance, in my family, we used to get everyone gifts, and then we're like, gosh, we don't need that. So the generation above gives to the generation below. So that's just one simple change that we made that made a difference in our family. And I'd encourage you to remember that at other times besides the holidays. Just because you've always worked for someone else doesn't mean you can't go out there and start your own business. So do what works for you, and remember that you don't always have to do it just because you have. So let's tell you about tonight's guest. After some time in corporate America, followed by extensive international travel, Dr. Aliya Gard was enlightened to the benefits of chiropractic care and became a chiropractor. She received her doctorate of chiropractic also from Cleveland Chiropractic College in Kansas. Say that 5 times fast. While attending Cleveland Chiropractic College, she studied extensively at the Acupuncture Society of America under Dr. Richard Yenny, the pioneer of chiropractic acupuncture. Dr. Aliya is certified in chiropractic acupuncture and is a fellow of the Acupuncture Society of America. Dr. Gard enjoys working with all ages and has received advanced training in the treatment of pregnant mothers, infants, and children through the International Chiropractic Pediatric Association. She has witnessed in her own life and recent pregnancy the amazing effects chiropractic treatment can have on health and body function. When not in the office, Dr. Gard can be found exploring local parks, greenways, and lakes, as well as the North Carolina coast with her husband and their sons, Pearson and Simon. Welcome, Aliya.
Thank you, Julie. Thank you for having me.
I just want to give Aliya a shout out because she just gave birth almost 2 months ago to little Simon. So she's a trooper, probably hasn't slept in 2 months, yet is here tonight doing the show.
Thank you. Great to be here.
And we also have to give her a double shout out because she's a West Virginian by marriage. So anyone who does that, gold stars in my book, since I'm a native West Virginian. Let's get to acupuncture tonight. So, Aliya, tell us just right off the bat, what's acupuncture?
Simply put, acupuncture is the creation of balance within the body. So, the traditional Chinese medicine theorizes that disease is brought on by an imbalance of the flow of qi. So, essentially, what acupuncture does is it applies either a needle or pressure or electric stimulation to a point along a meridian where this qi flows. And by stimulating this point, you remove the blockage and allow for a free flow of that energy, therefore restoring balance to the body. So that's essentially what acupuncture is about, is just restoring balance to the body so that it can operate naturally the way it was intended.
So if there's one thing that if there's a blockage of energy, that's something that acupuncture obviously would be able to correct then.
Exactly.
And so can you tell us a little bit about the history? Didn't it start in China like 5,000 years ago or something like that?
Exactly. Depending on what source you follow, it started anywhere from 6 to 5 to 4,000 years ago. But let's just say it started a long time ago. The first record that was found was 4,000 BC, according to what I've read, and there are remnants of stone needles. If anyone has had acupuncture treatment, you can imagine maybe what a stone needle might feel like. I personally wouldn't want to have that experience. So needless to say, it was rather rough in its inception. So evidence of stone needles back to 4,000 BC created by an emperor and his physician. About 2,000 years later, there was the first document that was found, which was essentially writings between a physician and the current emperor, whose name I embarrassingly don't know. Fast forward, we find additional remains of both stone needles and needles that were carved out of bone, along with actual hieroglyphs on bone and on tortoise shells, which depicted the practitioners of the time performing acupuncture on patients. Fast forward, I think the yin-yang philosophy started coming into the writings of the time around 200 BC. And then when we consider the United States, it first appeared in the literature in about 1916 when a doctor proposed acupuncture treatment for the treatment of lumbago, which is basically low back pain. It simmered probably in the back halls and was not very well known until the 70s when President Nixon traveled to China. And during that trip, he had acupuncture treatment himself and also witnessed a surgical procedure. I think it was an appendectomy, and it was performed without anesthesia, only with acupuncture for pain management.
How interesting. I didn't know that. That's really a good historical context to share. So I'm sorry, go ahead.
No, I was just going to say, so from the 70s, it has taken off, and complementary and alternative medicine now is, making its way into hospital settings. Duke University Medical Center has a CAM wing. When I was in Kansas, the University of Kansas Medical Center had a CAM wing. And in those
CAM,
places,
you mean complementary and alternative medicine?
Exactly,
okay.
Exactly.
So I'm
making it into the mainstream.
Yeah, which is fantastic. So I'm curious, if you practice meditation, there are different types of meditation that you can learn, TM, other things. Are there specialties in acupuncture, or is it all basically whatever people are practicing is the same?
There are. Essentially, there are a few different kinds, the most popular of which is probably traditional Chinese medicine or classical acupuncture. And classical acupuncture uses the traditional Chinese medicine, I'll refer to it as TCM. It uses TCM form of diagnosis, which I can expound upon a little bit later, but essentially using different diagnostic tools to find out what the problem is and then to treat it with needles, acupuncture. There's also a Japanese style, which uses a little bit of a variation of diagnosis from my understanding. It also uses smaller needles, and it's less, I don't want to say less comprehensive because it all works, but less aggressive maybe in treatment, uses just less modalities, less needles. There is a Korean system, which uses the hand only, so that all of the functions of the body, all of the organs and the areas to treat are represented on the hand.
So like hand reflexology.
Exactly. Has its roots in Korean hand. And then there's medical acupuncture, which is the realm where I live. And that's basically doctors of chiropractic, doctors of osteopathy, DOs, and MDs who receive additional certification. So we practice acupuncture with what they call a formulary approach. So rather than using the TCM or the classical traditional Chinese medicine diagnostic criteria, we use Western diagnosis and then apply acupuncture treatment, an Eastern approach. So for example, if we had a patient who came in with diabetes, the traditional Chinese medicine practitioner would figure that out. The patient would probably tell them, but if they didn't, they might figure it out by a pulse check, by looking at the tongue, by observing different areas of the body, by asking certain questions. Whereas in Western diagnosis, we're going to run a hemoglobin A1C and their blood glucose, and there's the diagnosis.
Gotcha.
So, and then obviously most things are venturing into the veterinary world. So there's also a veterinary acupuncture.
Oh, that's fantastic. Now I want to remind everyone, if you have a question for Aliya, you can chat it in and I will ask her, or you can call us in at 919-518-9773, or if you're out there on Skype, Computers 2K Voice, and we'll make sure that you get your question answered by the expert. So I just, that's interesting that you do that. The first time I did acupuncture, and maybe you can explain to me why this worked, I severely sprained my ankle. And it was a situation where it would have been better if I had broken it, because it was just so severely sprained, but not to the point that it was broken. And a couple days after, I was in West Virginia before moving out to LA and traveling. And so I found someone who did acupuncture outside of Pittsburgh, and it gave me such immediate relief. And after that experience, it helped the swelling go down. And this was a couple days after it had happened. I'd gone to the doctor and like, you sprained it, just don't move it. So I have learned from that experience, if I ever had that again, the acupuncturist is the first person that I'm going to find relief. So you've talked about chi, and that's kind of the flow of energy. Can you talk about, in that situation, what was going on with my ankle and what did acupuncture do to help that?
So they've started to do research on exactly that question. How does it work if we're not talking about the flow of chi and all of these sort of esoteric things that nobody really understands in the Western world anyway? And there's basically, what they find is that there is a neurochemical response, there is a physiological response that has, to simplify it, sort of a cascade of chemicals in the body that help to reduce inflammation. So they've found that by stimulating acupuncture points, in your case, on your foot, on your ankle, or wherever it is in the body, there's this sort of multi-tiered cascade that happens physiologically in the body to bring about healing.
So in more esoteric terms, would you say that the chi or the energy flow to the ankle had been blocked because of the injury, and so that acupuncture helped open that up?
To be honest with you, I'm so entrenched and schooled in Western medicine that I'm more inclined to go with the explanation that's more tangible for me. But I believe that anything's possible. And the more I study and the more I wrap my mind around chi, the more I am able to really own that as well and more comfortably explain it in those terms.
Okay, that's good. I just thought I'd ask, throw it out there.
Yeah.
And the other thing I wanted to ask you is, while I'm thinking about it, because you're the first person I met and know that combines, or correct me if I'm wrong if you don't combine, so you do chiropractic care and combine it, or can combine it with acupuncture? How do those work together? How would you do that?
That's absolutely what we do. In my opinion, when we do them both together, I get a greater response. I get a greater reduction in pain, more sense of well-being. You know, if you think about what you're doing to the body, if someone has, low back pain, I can perform acupuncture on them. But if they have something structurally wrong, if there's a joint that's not moving appropriately, I believe, based on my training, based on what I've seen, that if I'm able to mobilize that joint with a manipulation with my hands and then supplement that with the acupuncture care, patients respond more quickly. I think they both work independently, but based on my training and based on what I've seen so far, I think that there's a faster response when you use them both together.
So is it something like, if someone were to come in and see you, would you look at maybe do a couple quick cracks or adjustments and then do it and find out where then you have more pain and then stick some needles in there and let them cook for a while? Good description. I like it. Yes. To answer your question, it's not quite a crack, but I would assess the spine with everything I do. I assess the spine and the joints to make sure everything's moving appropriately, because in my training and in nature and in biology and anatomy rather, if the spine is not moving correctly and all of those, there are 31 nerves that exit the spine. If there's an interference along that pathway anywhere up and down the spine, it will lead to problems. So, to ignore that piece of the medical equation, I think would be doing the patient a disservice. So yes, I definitely assess the spine and then treat with acupuncture as well. Can you talk about what disorders acupuncture can treat? Because I think a lot of people who aren't familiar with that would be like, well, why would I go see Aliya?
Oh, an easier question to answer might be what acupuncture doesn't treat. The World Health Organization, and we actually have this on our website, has a pretty extensive list of all of the conditions that can be treated. But, scanning down the body, disorders of the eyes, the nose, the ears, the throat, respiratory issues, bronchitis, asthma.
Digestive issues.
Exactly, digestive issues, heartburn, gastritis, reflux, all of these things, irritable bowel, ulcerative colitis. I have some patients who are responding really well who have GI issues. Everything musculoskeletal, sprains, strains, inflammation, things
stress
of that
too, I would think.
Pardon me?
Stress too?
Absolutely. There's a big emotional piece that happens with acupuncture treatment, anxiety, depression. It also treats addictions,
Oh, okay.
smoking, weight loss, all kinds of things.
We have a question from Jill Marie. She wants to know, what is the most common ailment that you treat with acupuncture?
Ooh, good question. Hello, Jill. I think at this point, it's probably going to be a combination of gastrointestinal issues, stomach upset, and things like that, and low back pain. Low back pain's huge.
Yeah, I
We
would
all
think.
sit so much and drive and sit and drive more and don't stretch that everybody has it.
We also have another question from audio. Well, actually, you're going to have to listen the entire night audio because Dr. Gard has a really great special that she's offering listeners tonight. But I'm not going to let her say it until the end because I want everyone to listen the entire hour. Haha. But they ask about insurance. Does insurance cover your acupuncture?
Yes.
And chiropractic care, I should say.
Chiropractic care, yes. We have yet to see any insurance that does not accept it. Acupuncture, it depends on whether or not your employer or yourself, if you're self-employed, purchase the rider for it. There are some insurers who have it and some that don't. We can use health spending accounts or flexible spending accounts and things like that to cover it as well.
So, okay, great. So thank you for that question, audio. So listen the entire time because she's going to do something awesome for us at the end. So I'm curious because you've talked about how with your Western medicine training, so it's a little different maybe than traditional Chinese medicine if someone's trained in that. So for instance, diabetes, do you view that differently? You talk about treating that from an acupuncturist perspective. Do you view that differently than someone in Western medicine, or because you've been trained in Western medicine, that's kind of from a diagnostic standpoint, that's kind of where you start from the Western medicine perspective?
I think that I have the diagnosis to start with, so I'm ahead of the Eastern medicine's diagnostic procedures. So for me, that's a great thing. But as far as what the treatment would consist of, obviously, I would use a formulary approach. So, for DCs, DOs, and MDs, we have a manual, a huge manual that has what points to use for what, and a algorithm basically to go down and see what's appropriate in which case. But I think where chiropractors and maybe the old medical professions, I think that it's changing in medical school currently. But chiropractors historically have a more vitalistic sense of health and well-being and healing that allows the body to really do a lot of the work, and talks more about lifestyle things that they can do, and really puts a little bit more onus on the patient to eat well, to lose weight, to do all of these things so that the body can do what it does, which is to heal and be healthy and be vital.
Now, I want to remind everyone we have another question. You're heating up the chat room tonight, Aliya.
Right.
If you do have a question, chat it in, and I'll make sure that I ask Dr. Gard, or you can call in at 919-518-9773, or for those listeners across the country, we're in Raleigh. I'm easy. Computer's 2K voice, and you can Skype that in. Warrior Spirit would like to know, what are some other modalities found in a hospital's CAM wing, and what are some unusual illnesses corrected by acupuncture?
I would say that from what I know, the CAM wings that I have exposure to would be massage, reflexology. I have heard of homeopaths being on staff, chiropractors, acupuncturists. Did I say reflexology? I don't know if I did. If I didn't, add reflexology. And that's about it so far in the hospital settings that I'm aware of. I'm sure there are more. They're popping up all the time because the powers that be are realizing that this really works, and it can actually be proactive in saving money on the back end, which is ultimately what we all know makes change.
Well, we had a couple weeks ago, we had a shaman on the show who shared with us that she is being welcomed slowly but surely into hospitals as well, which really blew me away because I was like, dang, I mean, for most people that's a little out there, but she said, no, it's starting to be accepted, which I thought was fantastic.
that is wonderful, surprising and wonderful.
Mm-hmm. So what unusual illnesses do you have any thoughts on that? That's kind of a hard question if you haven't.
I think the hardest thing that I've personally treated so far, the most stubborn case that I've had, was a gentleman who had familial tremors. And essentially what that is a genetic shaking, his or in his hands. And so he responded really well initially, and then it sort of tapered off. I think that was probably the most unusual case that I've had so far. But I'm sure there are more strange ones than that.
Mm-hmm. No, great. Thanks for answering that. So can you talk a little, you talked at the beginning, but just so people have an understanding, chi is energy. So when you say chi, you're just simply talking about the flow of energy. What can you explain to us what yin and yang are and what they represent and mean?
Yes. So yin and yang are basically, you can think of them as opposites, sun and moon, cold and hot. And the idea of the yin and the yang is to realize the interdependence they have upon one another. And that's essentially the balance there is what the key is in Chinese medicine. So always trying to achieve a balance between the yin and the yang. And, you know, this is getting a little bit ahead, but yin conditions are conditions that are cold, that are empty, that are inside the body. Yang conditions are outside the body. They're hot, they're full. Again, this is kind of a hard concept to wrap your head around, and I'm still doing it myself, but essentially it's opposites and their relationship with one another.
To create balance.
Exactly. And this exists in nature, everywhere in nature.
And then can you talk about meridians and points and what those are? Yes.
Meridians are basically lines in the body, and they're invisible lines. No one can see a meridian. I think some researchers have tried to see them or sense them in an electrical sense and have failed. But essentially there are 12 main meridians, and they run both from the top of the head to the feet and from the feet up. Along those 12 main meridians, there are about 361 points along each. And each meridian corresponds with an organ of the body. There are 2 extra meridians that have additional points that run along the midline of the front and the back of the body. And that's where the chi runs.
Okay. So then when you're doing acupuncture and sticking the needles in, then they will be along a meridian or a point, correct?
Correct.
Okay. Can you talk about, and I'm not sure if this goes with your training, but can you talk about the 8 principles to analyze symptoms and categorize symptoms? So if you have someone who comes in, or maybe you could give us an example. So someone comes in, you tell me what you want to talk about. They're like, hey, I want to lose weight, or I've got acid reflux, or I've got arthritis. How would you go about, can you kind of talk us through that?
I can. I wish I could provide a really solid example for that, but it's kind of outside my wheelhouse in that it is going back to the TCM methods of diagnosis. But just broadly, the 8 principles deal with interior and exterior, meaning where is the disharmony? Where's the imbalance? Is it interior, inside the body, an organ, or is it outside the body? Is it the skin? Is it, a muscle? It's not static, mind you. So something that begins as an interior disorder or dysfunction, or an exterior rather, can move interior. So they are also categorized as hot or cold, which basically describes the nature of whatever the dysfunction is. So for example, a hot condition, a fever. A hot condition would be a fever, whereas a cold condition would be a person who has the chills. Full or empty, is it a deficit of chi, or is it an excess of chi that you're dealing with? And then yin and yang sort of encapsulate all of those things. It describes the general want to say the general concept, but the general idea of the disorder, so that, yin is cold, yin is an empty disorder, yin is inside the body, yin organs are, the hollow organs inside, whereas, exterior, full and hot and big, those are all yang qualities. So they would, describe a condition that was yang in nature.
So if someone were come in, maybe you could talk us through that. So someone comes into you, you pick a condition. I'm trying to give people an idea who have never seen an acupuncturist, and maybe people out there haven't seen a chiropractor. So you're like, hey, I have whatever, want to lose weight, have heartburn. So then you, for instance, would not examine the tongue. Is that correct? Or do a pulse diagnosis?
Correct.
So then how would can you talk us through that? Like if someone comes to see you, what you do and what kind of questions you'd ask, or how would you know where to put the needle then if you haven't done a pulse diagnosis?
Absolutely. So when I initially have a patient who comes in, the first thing we're going to do is talk about why they're coming to see me, what their situation is, whether it be pain or some internal condition. For the most part, people start out having pain. That's why they come to me. And, as through investigation, through questioning, I realized there may be some more things going on. So we'd start with, why are you here? Really important in diagnosis is a really good medical history and family history. So we would take both of those things. A lot about lifestyle. I talk a lot about what their diet is, what they're doing for exercise, what sort of symptoms they have. It's called basically a review of systems. So you go through the entire body and you find out, are there problems with, sweating or vision or coughs or, you name it. And then basically from there, I would have a couple of differential diagnoses in my mind if the patient doesn't already have an idea of what's going on with them. And then from there, I would do either orthopedic tests to find out. We can send people out for lab work if we think that there's something going on that needs to be looked at a little bit further. But basically from that initial questioning, we'd go through with the appropriate tests and then come up with a diagnosis. And then once I have the diagnosis that I'm going to work with, that's when I consult the formulary. And I see, what points are listed. And sometimes, you'll look in the formulary and there's 50 points for a condition. And so from that point, you have to feel, you have to see what is tender, what's hot, what's appropriate to treat, because certainly not all of those points are going to be appropriate every time.
I have another question. I just want to remind everyone before I forget, if you have a question, 919-518-9773, or you can Skype in Computers 2K Voice, or I'm monitoring chat if you want to email in or chat in a question. So I'm curious, because you had mentioned this earlier. So a lot of times I think when people think of acupuncture or think of chiropractic care, that it's for a pain in the back, the acid reflux, and you talked about addiction and depression and treating that. Can you talk to us a little more about that? I'm like, for instance, how can that help? What does it do to help your addiction?
Well, there are points. The addiction piece is generally done with auriculotherapy. So the ear has a whole system which maps out the entire body. It's represented in the ear. There are certain points in the ear that are used for addiction. We use those points to help with weight loss. There are also points to deal with addictions, like you said, like smoking, like drugs, alcohol, whatever the addiction may be. And again, these are points that were given to me by my teacher, and I wish I could know exactly why they work and how they work, but I have seen them work. And
so do you know if it would? No, I mean, I totally believe it and have done acupuncture before. Would you say that maybe for addiction, then it maybe reduces the craving, so that somehow that's one step that it takes to not have to need whatever it is that you're addicted to?
Yes, and that could work. Well said, thank you. It can work much like the way the weight loss protocol does, so that the patients report feeling less hungry when we're doing weight loss treatment with them. and I've done more weight loss than I have with addiction. So I just have more firsthand experience with what patients have reported. But again, not feeling as hungry, feeling satisfied. So I would imagine that same feeling, that same mechanism would work for the addiction, where they just don't feel the same drive to consume or do whatever it is that needs to be done.
Well, if you could cure my addiction to cheese, I would be very grateful.
You and me both.
Oh my goodness, no doubt about that. So I want you to talk a little bit about, as I read in your bio, that during your pregnancy, so again, like chiropractic care, I could kind of see with pregnant women, but talk a little bit about the acupuncture and how that could benefit someone that's pregnant. Maybe morning sickness, but there's anything else that when you were pregnant that you used acupuncture for?
Yes, definitely morning sickness. I used that with both of my pregnancies. And I actually used acupuncture throughout my pregnancy. I used it for back pain. I used it, it's a little hard to get up on a chiropractic table sometimes when you're pregnant. And we do have special pillows that we use and things like that. But sometimes a needle is a little bit easier. Used it for that. And then used it to actually, with my first son, I used it to, sorry, I'm just drawing a complete blank, to speed up my delivery, not delivery. Sorry, I'm drawing a complete...
Labor.
Thank you. To go into labor.
Now,
to
cut her
induce.
some slack, everyone. Again, she's got a less than 2-month-old or 2-month-old and hasn't slept for 2 months. So that's all right. You definitely forgiven for everything tonight. So that's interesting. So you use that to speed up your labor.
Yep, to speed up the labor and to induce my first son. It can also be used to turn breech position. And I used it I didn't actually get it together to bring needles with me for my first son and was too out of it to use pressure points. But for my second son's delivery, my husband did a lot of acupressure when I was in the whirlpool tub. We had, again, forgotten needles in the last minute run to the birthing center. So he did a lot of acupressure, and that helped substantially with my labor pains.
So if someone were coming to see you that were pregnant, would you be able to throw like, okay, I'm in labor, it's 3 a.m, can you come into the hospital and help me chop on this labor? So that's something that you do?
Yes, chiropractors do have hospital privileges in North Carolina. So yay for that. And, depending on the patient relationship, I would be more than happy to get up at 3 a.m. for that treatment.
I just find that really interesting because I would have thought morning sickness, but I wouldn't have thought about the breech birth and to help speed up, gosh, you got to bottle that. You could be a gazillionaire. All the women out there love to speed up the labor process.
We're trying.
And I also have to mention Aliya is our second guest. She and her husband work together, Dr. Aliya Gard. We had a couple on. They've been on separate times, but who also do quantum neurology and chiropractic care, soft touch chiropractic care. So you're the second husband and wife team on the show. So that's fantastic. I have to say that's great. You guys can work together and live together and create babies. I mean, hey, that's fantastic. More power to you.
We do work alternate hours. I will throw that out there.
Okay. Oh, we have a question, and let's see. Another question from Warrior Spirit. Do you treat yin issues with yang points and vice versa? And does that make any sense? So I guess what they're saying, so if you have a yin issue, does that mean that the yang needs to be increased to make it balanced?
Yes. So if there's a deficiency, you want to treat that point so that you bring more energy to that point. Whereas if there's an excess, you would want to sedate that point. You wouldn't want to tonify that point. So in that sense, yes, if there's a deficiency, you are treating to tonify that point.
Got it. And I missed another one. That's why I'm wearing my contacts. I'm single. What can I say? But if I had my glasses, I could read better. We have one from Cannon's mom. Have you seen any benefits with pregnancy-induced hypertension?
Hello, Cannon's mom. We have not yet. We hoped to, but we did not. I did have one patient that I treated with some points for that, and was unsuccessful.
Okay. That's good. Sometimes it works, sometimes it doesn't. All good. So I know it's hard to say. Well, this is one thing I want you to talk about, that I'm on a personal mission. Because we had another guest on who talked about traditional Chinese medicine, and in California where she was trained, it's illegal to sell a package to say, okay, buy 60 sessions from me. And so I'm curious if you have any thoughts on that, or were you were trained about that, because what I also want to know is, and again, every individual's different, and hopefully people out there understand that, but if someone were to say, okay, I have acid reflux, do you have an approximation of how many sessions, again, understanding everyone's different, and they might come in for X and you find out they have A, B, and C, but is there a rough number of sessions? Because I know that sometimes people want to know that, like, am I going to have 60 sessions? Because that happened to me personally, and that was wrong, and so that's part of my personal mission to get the word out about that. Now, I should say it's not illegal in North Carolina to sell packages, but it is in California and in other states. So illegal, no. Unethical, I would probably say yes, but you're the expert, so thoughts
I
on
would
that?
completely agree with you. 60 sessions, in my opinion, is a little bit of overkill. I generally have patients, when I say a little, I mean a lot. I generally have patients who respond, they feel something after the first visit. Bar none, every single patient has felt an improvement after the first visit. From there, sometimes it tapers off, but if I don't have any response in about 6 to 8 visits, it's my opinion that what I'm doing either needs to change, or I need to refer that patient out to somebody else who can better serve their needs.
Fantastic. Thank you. I appreciate that. And I can say, because I know her personally, that she's ethical and stuff. But one of the reasons I do this show is to not only educate about how you can help people, but to know if they're in California or they're in Minnesota, what to look for. And we'll get a little more into that later. But we have another question. You were just, everyone's loving you on chat. Audio has a question. My adult son has chronic IBS as far as we know. No conventional medical doctor has been able to provide him with any relief. How would you treat him? He has a very active bowel.
I actually have a patient that I'm dealing with right now who has had ulcerative colitis for 10 years and is having amazing results with acupuncture. He's gone, the whole Western medical route and had very little success. And acupuncture, he has said, has made a huge difference. So yes, there are points to treat that condition. There are certainly, some dietary considerations that I'm sure you've looked into, but with a patient like that, what I've done for this other patient is it includes basically a prescription. We don't prescribe drugs, but a prescription for some supplements, some things that I would suggest to decrease the inflammation, to help the digestive process, and do that along with acupuncture to try to bring some relief and eliminate those symptoms.
I also have another question with you. I saw a friend this morning that I hadn't seen in a while, and she had surgery, and I didn't know that she had had surgery. And the surgery was to correct the esophagus. Apparently she'd had acid reflux, and there was a little too much of that. But now what she's finding, and I thought I'll have to ask Aliya tonight, she's having trouble having the food continue to go down, even though she's had this surgery. So is that something maybe acupuncture could help relax the muscles or treat that? Or is that at a point, well, I guess I should ask this. At any point, excluding death, of course, can you not treat something? Do you know what I mean? If you're like, oh gosh, you're really at a point like this is too far gone where there's probably nothing we can do. I mean, a severe, maybe like if someone was in stage 4 of cancer, maybe that's something you're like, gosh, we might be able to give them pain relief, but as far as helping with that.
Exactly. That would be one condition that I would certainly do palliative care. I would try to help with pain relief, but beyond that, we all have our limitations, and certainly curing cancer is not one of them for me. Having said that, there's nothing I wouldn't treat, but what I would make sure happened was if that patient needed to see another specialist, if there was some modality, be it Eastern, be it Western, that was going to truly help that patient that I couldn't provide, I would make sure that they were referred out to receive that treatment in conjunction with acupuncture.
And so would you be open, and we have a question, I'll get your question second, would you be open then, it sounds like, to working with a traditional MD, with working with maybe a reflexologist, whatever, something you would be willing to work in conjunction if someone was seeking treatment with other practitioners?
Absolutely. And I think ultimately, that's the best for a lot of patients, is to have a multidisciplinary approach where, there are other opinions, there are other treating providers that have, other specialties different from your own that can truly help that patient.
Okay, we've got another question on chat from Weeb. Hello from Kansas. Hello to Kansas. How do you treat stress and insomnia?
There are special points for stress and insomnia, both of which can be helped. I treat a lot of patients for stress, and interestingly enough, I treat patients for stress, some of whom I don't tell I'm treating for stress. I may be divulging my secrets, but oftentimes they come back in and report that they felt more of a sense of calm after last treatment, or they didn't have that bout of road rage, or whatever the case is. But that's often a protocol that I add in treatment, whether or not people request it, because I think we're all stressed. But yes, there are points for insomnia.
I have read a fact that 80% of our medical expenditures are stress related now, which I was going to ask you about that, because I would think if someone didn't know that, or for instance, so something like IBS or insomnia, to me, that's just a symptom of stress, that at the bottom of it, at the root of it, it's stress going on, and that needs to be treated. And so I think with acupuncture, you do that, right? You want to get to the root of the problem and not just bandage it. And, which I tend to think more Western medicine does that. Like trying to just think, okay, let's just treat the symptom, but not get to what the issue is.
Exactly. And I think that's the big fail of Western medicine, is to not look at the body as a whole and see what other things are going on, be it physically or emotionally, that are leading to problem X.
We've got another question from Cannon's mom, and I want to remind everyone we're really burning up the chat line, but if you want to call in and ask Dr. Gard a question, 919-518-9773, or Skype in at Computers 2K Voice. Okay, Cannon's mom would like to know, are there any points... Oh, we've got another question, too. Are there any points particularly for snoring that would solve my insomnia?
Yes, there definitely are points for snoring. And they're pretty successful. I've had a couple of patients who've been treated for snoring, and both them and their wives have reported less snoring.
There you go. Okay, we have a question from Kevin Levin, and hopefully I'm saying that correctly. My 4-year-old son has had recurrent ear infections, and while we have tried osteopathic manipulation, we have not tried acupuncture. He had tubes put in at age 1, but continued to get painful ear infections which pushed the tubes out. Just had the tubes put in again. Do you think acupuncture would help? Yes, I would definitely try it. Absolutely. I would also suggest trying manipulation. I'm not sure how many times Mr. Levin tried, but I would suggest trying again, finding someone who is either a chiropractic pediatrician or an osteopath to do that procedure. But definitely both should help, I hope. Excellent. Well, you know what? It can't hurt to try. I mean, I would assume with something like that, you can't do any harm. And you know enough not to puncture an organ or anything, right? Exactly. Okay. So while on the subject of needles, what would you say? I watched some god-awful show the other day, and they had someone who was terrified of needles. So, of course, they take him to an acupuncturist and put it looked like a needle in every possible place on his body. But to someone that's afraid of needles, what would you say to them? I mean, again, never should force anyone to do anything, but because acupuncture can do so much good, do you have any advice to someone to be like, you know what? I've wanted to try it, but I'm just too afraid of the needles. Oftentimes what I'll do is I'll share what every other patient says, which is almost exactly that. I really want to try it, but I'm afraid of needles. And what I say to that is that everyone feels the same way, and very, very, very few people report anything more than a slight pinch, and then it goes away.
For some patients, it helps to see the needle, and they realize exactly how small it is. And, that tends to ease their fears. And if it doesn't, if they truly are just not into needles, there are other methods. We can do electroacupuncture using what's called a pointer plus, and delivers a little stimulation to the same point along the same meridian. Or like I talked about with my birth of my son Simon, you can use acupressure along the same point, along the same meridian, to elicit the same response.
And can you address, for someone who's never seen an acupuncturist, any safety concerns that they might have, like what's going on with the needles? Are they sterilized? Can you talk a little bit about that?
I would make sure, personally, I would not see somebody unless they were using disposable needles. I don't honestly know of anybody in the profession that I am familiar with that still uses needles that need to be autoclaved to be sterilized. But personally, I would just stick with someone who uses disposable needles and clean needle technique. You don't want to see needles thrown in the trash can. They need to be in a biohazard disposal. Some alcohol swipes, just general cleanliness and sterility is what you want to look for.
Right. No dirt all over the floor.
Exactly.
So is there any scientific research that says, hey, acupuncture works?
So I actually just had this question the other day, and so I had to do a PubMed search, and PubMed is basically a clearinghouse of all of peer-reviewed journals. So supposedly the gold standard is the randomized controlled trial, and I have found studies for osteoarthritis, depression, shoulder pain, tension-type headache, migraines, cancer-related pain, irritable bowel, ADHD, stroke, nearsightedness, insomnia, traumatic brain injuries, and nausea, and that's to name a few. That was on probably up to page 3 of 98.
And so probably if someone Googled, they would just be able to find enough. If they were like, hey, you know what, I'm interested, but I'm not quite there yet. There's enough studies out there that most people would say, okay, it works.
Exactly. There are some that works. There are a lot of those studies, however, who say that there wasn't enough information to draw a conclusion. And the problem with a randomized controlled trial in acupuncture is that, their control group is a sham treatment. Well, how do you really give a sham treatment? And there are some holes in research, in my opinion. So I really weigh more heavily on anecdotal evidence on, do you have friends who had good responses? Do you have, look for the stories from the people, is my opinion.
And can you talk about, because we have listeners all over the country and internationally, can you talk about what should someone look for if they want to see an acupuncturist? If they have, do they need to have a license? What do they know so that they have a legit person?
You want to make sure the person is either a licensed acupuncturist or someone like myself who is either a DC, a DO, or an MD who has an advanced certification in acupuncture. Those are really the only two people that I would probably go to if I were a patient looking. I would also, I would ask friends. I always just steer clear of the phone book. I don't know why that is, but I would always rather a personal referral over any other source.
Aliya, go ahead and restart your Skype because your picture got all messed up. So go ahead and just shut it down.
Shut it down and restart it?
Just Skype, yeah.
Okay.
Okay, so while Aliya is doing that, sorry about that. We've had a thunderstorm tonight in Raleigh, and we had the lights flickering here for a moment in the studio, so sometimes that happens with the good old technology. So we've had excellent questions tonight. I want to remind everyone, if you have a question for Dr. Aliya, you can call in at 919-518-9773 or Skype in at Computers 2K Voice, or chat. We'll make sure that we get your question asked. There she is. She's back.
Sorry about that. I don't know what happened.
Well, I was telling everyone we had to have an awful thunderstorm, at least in this part of town in Raleigh, and maybe that, if it's in your area too. So great suggestions on how to find a good acupuncturist. And then can you just talk about, because because I sometimes think CAM gets a bad rap. How are acupuncturists regulated? For instance, in North Carolina, you have to take a test, board. How does all that work?
I can speak for chiropractors. For chiropractors, they have to submit to the National Chiropractic Board evidence of their training. So in North Carolina, it's a minimum of 200 hours of training. In other states, I think North Carolina has the highest training requirement for DCs, which is 200. Other states require only 100. For licensed acupuncturists, I believe they have their own governing body, and they obviously submit to that board and probably test at that board.
Okay, fantastic. So can you tell us a little bit, are there any specialties that you found, like, gosh, I tend to attract a lot of patients that need X work, or that because obviously acupuncture can treat a lot of things, but is there anything that you seem to have a specialty in and to treat a lot of people?
Well, interestingly enough, and this kind of started while I was in chiropractic school, treating with chiropractic, I didn't do acupuncture at that point, but children and pregnant women seem to have fallen into my lap throughout school and in private practice. And I never really set out to have a pediatric practice, but really, really enjoyed it. And so have done advanced training in that as well. But we treat all ages.
Well, talk to me a little bit about why would a child need acupuncture? What are some of the things that you'd treat?
For anything, ADHD, hopefully, like Mr. Levin said, chronic ear infections. And although those are really so prevalent, I haven't had any of those in my office. I've had GI issues. Again, a lot of GI issues, and some of this obviously is diet related. Mm-hmm. The standard American diet is pretty poor, and so we do a lot of diet counseling, nutritional counseling.
Oh, that's good to know. Our guest last week had an amazing story. She had reactive arthritis and was literally in a wheelchair and got herself better and now runs 30 to 50 miles for fun. But her first step was to do an elimination diet and figure out what was causing the inflammation. And she did an exhaustive research and did a book. And that's the first. We talked almost the entire hour just on the diet alone. And it was fascinating what she came up with. Here's a very interesting question from Cindy. What about treating hair loss?
I have not had any experience treating hair loss. I have, however, had a patient expressed interest in it. And I'm sure there are points out there, but I need to do some research and find what those are. But like I said, there's nothing I wouldn't try. Right. Acupuncture won't hurt. It can only help. And so I would definitely give it a try. But touching back on what Julie said about, it's appropriate to stop that train if it's not working in, 6 to 8 sessions. With hair loss, it might take a little bit longer, but, we would hope to have some.
Now, even though I'm not a doctor and don't play one on TV, I'm just going to throw something out there that perhaps it's stress related. That I wonder if the hair, or unless something happens. So again, that goes back to our earlier point of if we're suffering from stress, which, as you said, probably all of us are. I can't think anyone, maybe the Dalai Lama, he doesn't suffer from stress, but for the rest of us, that would help, I would think. And at least maybe that, even though we're like, we'd have to look up about directly treating the hair loss. If you were able to start just treating maybe the underlying stress, that might be a side benefit.
Exactly. And that's really good point. And that's something that would come about in the initial intake. In my initial questioning, we would get to the emotional piece, and probably it sounds like might go there if that was appropriate. Okay,
great. Yeah, again, not a doctor anywhere near it, but just thought I'd throw that out there. So, Leah, I want you to, I have a couple more questions that I always ask guests, because someone out there, we've had hair loss, IBS, lots of concerns out there. So people could be in a really bad space, really frustrated, really sad. What advice would you give to them if they're just really struggling and just hanging on? What's your advice to help them? They think the pain's never going to end. What would you say to someone?
I would tell someone to try everything, to try any sort of modality they can possibly think might help them, and try it not only just to sort of cross it off the list and say, okay, I tried that didn't work, what's next, but to try it with an open mind and an open heart, and also to realize that And my dad used to tell this to me all the time when I was growing up, and I thought it was so ridiculous, but now I get it, that life is a series of moments, and this too shall pass. And as cliched as that sounds, it helps bring about a little bit more of a positive mental attitude, and that in itself can help stimulate some healing. So, try everything with an open mind, all the modalities you can find, do the research, and have a positive outlook that it can change. And most times it does.
I think that's wonderful advice. And as we get older, we get wiser, and we listen to our parents a little bit more. So I have another question. People who are out there listening, I'm all about reawakening your brilliance. So what one step would you say to people, hey, do it tonight, do it in the morning, would you say that they can do to reawaken their brilliance?
One step to reawaken your brilliance would be to be positive. Mm-hmm. To be positive in your thoughts, to be positive in your words, to be mindful of the things that you bring into your wheelhouse, to your sphere, trash on TV, things like that. Just really try to cultivate a place of positivity, because that spreads. It spreads to the people who then reverberate that back to you. It grows quickly like a snowball.
So are you telling me I have to give up my guilty pleasure of the Real Housewives? God-awful series. Okay, I'm sorry. I shouldn't even admit that I say that to anyone.
No, you don't have to. I have a couple of guilty pleasures too, but we use a sieve.
So we'll leave it at that. And we have a great question from audio, which then I'm gonna lead into your wonderful offer that you're doing for our guests tonight. Can you see any additional patients before the end of the year? HSA has money in it. So please tell everyone about the generous offer that you decided, and I did not put a gun to her head. She said, hey, I'm going to offer this to everyone. So tell everyone about your great offer.
Yes, we do accept HSA, and the offer is to everyone that has listened to this show, has liked Reawaken Your Brilliance on Facebook, as well as Gard Chiropractic on Facebook. We're offering a free examination and 50% off your first treatment.
So you heard that here, but there's a catch. For those of you who hung out and watched the entire show, you've got to like Reawaken Your Brilliance on Facebook, and on the page right there, Amnon's got the little Facebook thing, and Gard Chiropractic. You have to like that as well. Free assessment and half off the first session. And then, Aliya, do you and Lance have anything coming up? Any classes or anything that you want to share?
Actually, a little short notice, but my husband Lance is doing a talk tomorrow night. He works a lot with athletes, and he's doing a talk for triathletes and, obviously runners, swimmers, bikers separately at Tri Sports in Raleigh. And that's at 6:30, and he'll be talking about how chiropractic care can help with increasing times in all of those three sports, as well as leading to an injury-free season.
And Lance is a West Virginian, fellow West Virginia. He's a good egg. So, Aliya, how can people take advantage of this offer? They've got to like the pages, but can you give out your phone number and website so people can get a hold of you?
I can. It's gardchiropractic.com, Gard chiropractic.com. And our phone number to call for a schedule an appointment is 919-397-3231.
Fantastic. And we have all that information up there. And I want to thank you, Aliya, for taking time out of having a baby and working and all that other stuff to be on the show tonight.
Thank you so much for having me.
Namaste.
Namaste, Julie.
You are tuned to Reawaken Your Brilliance on the Nissan Communications Network. Listen to some of our other programs like Computers 2K Now with Amnon Nissan Sundays 9 a.m. to noon. Attitude for Business with Mike Sink, Mondays 3 to 3:30 p.m. Breaking Free with Marilyn Shannon, Mondays 8 to 9 p.m. And if you tuned in too late, you can always watch the program in its entirety or download an MP3 audio file of it at www.nissancommunications.com.